Everyone has experience when they go on a mountain or a high place. They try to breathe very fast. It's because our body is going into a condition. That condition name is called hypoxia. So in this video we'll discuss about hypoxia and their types. That is hypoxic hypoxia, then anemic hypoxia, ischemic hypoxia and histotoxic hypoxia. And which type of hypoxia is related to this blue discoloration of skin, that is cyanosis. This hypoxic hypoxia and ischemic hypoxia responsible for cyanosis. Here in anemic and histotoxic, here absence of cyanosis. So we will discuss these four types one by one. Understand these terms better. First we should know that physiology. So we breathe in air and this air will go to lungs and it will go into that lungs, it will go into that arterial blood flow, arterial blood, and it will picked up by that hemoglobin and then it will go into the tissue. Then the tissue will use this oxygen and form ATP and it will converted into carbon dioxide. That carbon dioxide, then this carbon dioxide will go to that blood going into that lungs. It will breathe out and this degrees of oxygen in tissue, and this condition name is called as hypoxia. Degrees of carbon dioxide in blood, that condition name is called as hypoxemia. So two condition, hypoxia condition, decreasing O2, decreasing carbon dioxide, that condition name is called as hypoxemia. Two condition. So here what is the physiology? When we are breathing, breathe air will go to lungs and it will go to arterial blood and this will pick up by hemoglobin. Then it will go to tissue, it will use for oxygen and form ATP and it will converted into carbon dioxide. That carbon dioxide will go to blood going into that lungs. It will breathe out this decrease oxygen at the tissue level, that condition name is called as hypoxia condition. Decreasing carbon dioxide, that condition name is called as hypoxemia condition. There are four conditions of hypoxia: hypoxic, anemic, ischemic and histotoxic. In this first one is hypoxic hypoxia we want to discuss. In hypoxic hypoxia, there is a problem of O2 going into that blood vessels and it can be two cases. Either oxygen is not there or there is a problem in gas exchange. So first, if oxygen is not in atmosphere, it can be a person high altitude, okay, less amount of oxygen, it can be a person at a high altitude or if a person in closer. And the second problem is gas exchange. It can be because of any lungs pathology, can be COPD or it can be pneumonia or it can be alveolitis or it can be pleuritis and many more. So this one, less amount of oxygen in atmosphere or problem in gas exchange. It is because of lungs pathology, COPD, pneumonia, alveolitis or pleuritis and many more. Next is second condition, anemic hypoxia. In anemic hypoxia, oxygen is normal. It can easily, so here oxygen is normal, it can easily diffuse with the blood vessels. The problem is either RBC is not here. Here that problem, second one is oxygen is present, it easily diffuse to that organ, blood vessels, but here RBC is the problem. RBC is not there, otherwise decrease in hemoglobin. Because of this, O2 will not able to go into that tissue. Because of this one, here RBC or hemoglobin is problem, so this O2 cannot reach to that tissue. So this one can be any type of anemia. So here second one is anemic hypoxia condition. Oxygen was normal, it can easily diffuse into the blood vessels. The problem, either RBC is not here, otherwise decrease in hemoglobin. Because of this, oxygen will not able to go into the tissue. It can be any anemia. It can be vitamin B12 deficiency anemia, or it can be iron deficiency anemia, or it can be hemolytic anemia, or it can be any other type of anemia. So this one happened because of anemic condition. Oxygen will reach to blood vessels, but here less amount of this RBC or hemoglobin. That reason this oxygen cannot reach to tissue. So second one is the problem. First one is atmospheric, that oxygen is the problem. Third one is ischemic hypoxia condition. If there is any obstruction, okay, so here any obstruction, that RBC will not able to cross, okay, that RBC cannot able to cross this area, and this will cause decreasing O2 in that tissue. So here obstruction, because that oxygen cannot reach to that tissue, so this condition will happen. So here obstruction, so that RBC will not able to cross that area, and this will causes decreasing O2 in tissue, that causes hypoxia, and it can be because of new obstruction like thrombus. Okay, this one because of thrombus. It can be because of there is a whole decrease in blood volume. Because of obstruction, decreasing blood volume. If there is conjunctive heart failure, heart is not able to pump the blood, so there will be decrease in blood volume. So here because of obstruction, conjunctive heart failure, heart not able to pump the blood, so decreasing blood volume. Last one is histotoxic hypoxia condition. Here everything is normal. Oxygen is coming in, always diffusing, RBC is normal. So fourth condition, everything is normal. Oxygen is coming, here always diffusing with RBC. So that one also normal. Oxygen is going into the tissue. So this oxygen will go into the tissue. But the problem here lies in tissue. Here fourth one is problem is tissue. Tissue will not able to utilizing that oxygen. This and it can be there is a cyanide poisoning. So fourth condition, histotoxic, everything is normal. Oxygen is coming and diffusing, RBC is normal. Oxygen is going into the tissue, but the problem here lies in tissue. Tissue will not able to utilizing oxygen, and it can be if there is a cyanide poisoning. Now next thing, in which type of hypoxia cyanosis takes place? Cyanosis is blue discoloration of skin and mucous membrane because of increased deoxygenated hemoglobin. Increased deoxygenated hemoglobin means this is important. Hemoglobin without oxygen is important. So in hypoxia, hemoglobin normal but oxygen level decreasing, so cyanosis is present. Second, anemic hypoxia condition. Here hemoglobin is absent. Hemoglobin absent, oxygen is normal. For having cyanosis, hemoglobin should be there, so that it can be without oxygen. Without oxygen, here hemoglobin is not here, absent only, so we cannot see the cyanosis. Here no cyanosis. No cyanosis in anemic hypoxia condition. Third one is ischemic hypoxia condition. This one hemoglobin is normal, oxygen is also normal, but still we can see that cyanosis because there is increased tissue consumption, increasing tissue consumption. And what is the tissue consumption? Suppose this is the tissue, okay, this one is the blood vessels coming in and going out. So here there is obstruction. Here because of obstruction, blood is coming here, blood velocity will decrease. So here blood velocity will decrease. This will causes more blood will stain tissue. More blood will stain tissue. So there is more time of consumption. So more time of consumption. So tissue will consume more, and that is tissue consumption increases. And at the end, when the blood is going out, the hemoglobin still normal, oxygen also normal. So here we can find out cyanosis. Last one is histotoxic hypoxia condition. Here hemoglobin normal, oxygen also normal, tissue consumption decreasing. So we cannot see hemoglobin without oxygen because there is no tissue consumption. So here no cyanosis. So we cannot see hemoglobin without oxygen because there is no tissue consumption. So no cyanosis. Here cyanosis absent. In hypoxia, hypoxic hypoxia condition and histotoxic hypoxia condition, anemic hypoxia condition and ischemic hypoxia condition. First, anemic hypoxia condition, no cyanosis. Ischemic having cyanosis. Then histotoxic having ischemic having cyanosis. Then histotoxic absence of cyanosis. So this is all about hypoxia and cyanosis. Thanks for watching.